Okay, guys, so this is the last part of your blood lecture, which we are focusing on leukocytes, categories of leukocytes, as well as platelets and its functionality. So we talked about leukocytes and we mentioned that there are five different type of white blood cells, and they're mainly categorized based on the presence of granules, as identified as granular leukocytes versus agranular leukocytes. And we can also categorize them based on their frequency, which is the sentence we had: never let monkey eat banana, neutrophils, lymphocytes, monocytes, eosinophils, and basophils. So let's go ahead and take a look at some of the main functions associated with each category of these white blood cells. We're going to start with the most frequent type of white blood cells, known as neutrophils. These are considered to be phagocytic cells. As you guys may recall, phagocytics implies that they have the ability to basically engulf. They have the ability to basically engulf um, your any site of pathogens, anything that can contain and cause any infection, and basically digest those particles. Again, if you guys recall, phagocytosis is a form of endocytosis that basically your white blood cells bring foreign material into the cell. They have an ability to migrate to the location of the or site of infection at a relatively fast pace. So it is one of the first cells that are present at the site of infection. Now, when you look at their structure and their ability to basically destroy any sort of infective agents, looking at them, they carry a high concentration of digestive enzymes, which helps them with basically breaking down foreign materials. Their characteristics, as far as the structure goes, their nucleus actually can have between 2 to 6 lobes. So if you take a look at this, you can say you have 1, 2, 3, 4, and then one right here. These are 5 lobes nucleus. Typically what happens is as the neutrophils get older, the number of the lobes associated with the neutrophils, lobes of nucleus associated with the neutrophils also increase. Now, if you take a look at the granules colors under the microscope, they appear actually both as pink/purple, because they both pick up the acidic dye, which is basically pink, and the basic stains, which have a hint of purple to them. Therefore, they appear under the microscope as both slightly purplish color. So what we identified as pus that is usually released in the site of infection is basically what is being released as release of bacteria-destroying substances by your neutrophils causes basically to destroy the pathogens or anything that can cause infection. But it also can cause a significant damage to the tissue itself. So by the time the job of the neutrophils are done, what is released as pus is basically going to be the neutrophils, other categories of leukocytes, and any type of tissue or debris that are bacterial debris that is left on the site of infection. And that's what gets released as pus. Now, the second category of granulocytes, which are technically one of the least common type of white blood cells, are called eosinophils. So between every 100 white blood cells that you observe, you will observe 1 to up to 4 of these eosinophils. They have a very distinctive red granulocytes, as you can see right here. Their main job is to fight off parasitic infections. So what they do is they actually attach themselves to the parasite and they release the material directly in the environment of the parasite, which causes its destruction. They also have the ability to end allergic reactions by degrading the components that are considered to be produced by your own white blood cells that can cause the allergic response. Those molecules are known as histones, and basically they destroy those molecules. They are also present at high concentrations um, inside your digestive tract, especially if you have some sort of parasitic infection. All right. The next category of granulocytes that we have, which is a third and last one, is the least common type of white blood cells, which are identified as basophils. Basophils appear as very purple when you look at them under the microscope. So you can see all of the granulars within the structure look very purple, very pronounced. They are extremely rare in concentration. So typically we say about 0.5 to 1% of the leukocytes. So in many cases, when you guys do look at histology of the white blood cells, you may not actually be able to spot basophils because they're considered very rare. Another characteristic that these type of leukocytes, basophils, do have is that they have a very pronounced two-lobe nucleus. But the problem is, especially in this picture, is because they have a very purple stained granulocytes within their cytoplasm, they are relatively harder to observe the nucleus. But the easiest way to identify them is look for very, as it says, very dark purple structures under the microscope. The main function associated with basophils is creation of inflammation during fighting during any type of basically immune defense in your body. What they do, they actually release histones to be able to accomplish their task. So if we learned previously, when we're talking about eosinophils, and we says they are responsible for degradation of histones, basically what we're saying is the eosinophils counteract the effect of your basophils. Looking at agranulocytes, basically the ones that lack any form of granules inside their stained granules inside their cytoplasm. One of the main categories are lymphocytes. Now, you might actually have heard of lymphocytes in general conversation. There are two main categories of them, B lymphocytes and T lymphocytes, which we actually represent them as B cells and T cells. If you have any sort of studies in the sense of HIV virus or any type of disease that actually causes an immune suppressive condition, they can be associated with your B cells and T cells. These are extremely important in the sense of creating an immune response in your body. We'll talk about them in more detail in lymphatic system. They have a very, very pronounced nucleus. As you can see, this nucleus kind of takes over the whole cell. So there's very limited cytoplasm in that cell. And they actually are very specific. So if you're thinking about lymphocytes, they don't just randomly attack everything, but they actually rather act as very specific or target very specific molecules by identifying a specific type of protein called antigens. We will discuss these in more detail when we talk about lymphatic system. The last category of your white blood cells are referred to as monocytes. Monocytes are also considered relatively low concentration, so about 4 to 8% of these cells are form the total percentage of your white blood cells. These cells, as you can see, they have not much staining in their, there is no staining in their cytoplasm, but what they have is they have a very pronounced kidney shape or U-shaped nucleus within them, which makes them relatively easy to identify. Interestingly, for the other categories of white blood cells, you just have the primary name. But in the case of monocytes is basically an immature form of the cells. And when they get to the tissue and they find the infection to fight it off, they actually transform to their mature cells called macrophages. These are also identified as phagocytic cells, which basically means they have the ability to engulf any sort of infective agent and destroy them using their lysosomes. So again, they do contain typical lysosomes, but as I mentioned, those lysosomes or those structures, granulars within the cells are not going to be stained with a typical stain, hence the word agranulocytes for them. Now, last category of formed elements within your blood is called platelets or thrombocytes. As I mentioned earlier, and if you guys recall, platelets work very closely with a protein found inside your blood plasma called fibrinogen to be able to effectively form a blood clot on the damaged blood vessels. What they're actually considered platelets, if you look at them, they come from a larger category of cells called megakaryocytes. So they themselves are not technically a full-grown cells, but they actually come from a much larger cells called megakaryocytes. As you can hear, the word mega implies really large. Again, their main function is formation of blood clots. What they do is they plug small holes at the walls of the blood vessels. They can bind to a specific type of protein called collagen fibers. It should sound familiar to you from the histology lecture. And they bind to the damaged area and basically enables the blood vessel to be plugged. What they also have the ability to do is they secrete from their granules solutions and molecules that will attract other platelets to the site of infection. The site of damage. These granulocytes, these material that being released from the platelets, also have the ability to constrict the blood vessel. So basically, if you have a damaged blood vessel, you don't want to supply a lot of blood to that tissue, you want to limit it. And they also trigger inflammation just in case there is foreign material that have entered as a result of damage to the blood vessels. Basically, like if you cut yourself, you also want to make sure you prevent any sort of infective agent from basically moving into your body from that breached point. And as I mentioned earlier, they initiate clotting. They generate a tough protein fiber network called fibrin network or fibrin network. As you can see here, they are going to trap your red blood cells. You can see right here. So these are the fibrin network, and these are your red blood cells. And the combination of these protein fibers and your red blood cells is basically what we identify as blood clot, not blood clot. Anyway, so the last component that I want to focus on is production of red blood cells. So we talked about destruction of red blood cells. Let's quickly talk about production of red blood cells. First of all, the process is known as hematopoiesis, as an blood cell hematopoiesis implies production or creation. We discussed that this process happens in the red bone marrow. And there's about 100 billion new blood cells that are formed every day. Just wrap your head around that. 100 billion new blood cells being produced every single day. Now, if you're looking at the cells within your red bone marrow to produce your blood cells, again, blood cells being implying red blood cells, white blood cells, and platelets. They come from two main categories of stem cells. One called the lymphoid stem cells, the other one called myeloid stem cells. Now, if you guys remember lymphocytes, the category of white blood cells that gives you your B cells and T cells, they have their own category of stem cells called lymphoid stem cells. Every other type of white blood cells, as well as platelets and red blood cells, are going to be produced by myeloid stem cells. So let's take a look at this concept. Let me go one more slide. So don't get panicked. You don't need to know all of these information. What I do want you guys to understand is just the drawing and the main components of this this diagram. So you have your blood cell, blood stem cells on top, and they're categorized to myeloid and lymphoid. Follow the lymphoid down all the way. What do you get? B lymphocytes and T lymphocytes. Myeloid stem cell undergoes its own change. One of these changes produces your red blood cells. The other one produces the other four main categories of your white blood cells, which are monocytes, neutrophils, basophils, and eosinophils. And the last breakdown of these stem cells produce your platelets. Now again, if you guys recall from the couple of slides back, we talked about platelets being produced from a larger cells called megakaryocytes. So do remember this name, that platelets do come from megakaryocytes. And just kind of looking at the sides, they are definitely much larger than your typical blood cells. Looking at some of the disorders associated with your blood, we have disorders associated with red blood cells. The first one called polycythemia, which basically implies a huge amount of production or a significant amount of erythrocyte production. And the next one is sickle cell anemia. Anytime you hear the word anemia, you should also automatically think about low concentration of, low RBC production. That's the main way that you guys want to look at it. Decrease in RBC production. So as soon as you hear the word anemia, that's what should come to your mind. Now, sickle cell anemia is a specific type of inherited form of anemia, which actually results in a defective form of hemoglobin that causes a change in the shape of your red blood cell. So this is a normal red blood cells, what you see here, the donut shape. And this is a sickle shape, like kind of like a semi-lunar shape, which describes the name sickle cell. These cells are, if you want to think about them, they are very hard to move through the blood vessels. They typically cause pain in the joint area because of their shape. They are destroyed more rapidly because they do not look like a normal cell, so your body do try to get rid of them. And typically for treatment for these individuals, they have to undergo blood transfusion often to make sure that their red blood cells are being replenished. Now, as I mentioned, anemia is identified as low concentration or low production of red blood cells. As a result, since red blood cells carry oxygen, you typically have low levels of oxygen in your bloodstream. Symptoms of it is pale, because basically you don't have as much as blood in your tissue, so your color looks pale. You look fatigued, short of breath, and chilled. So fatigue and short of breath is because typically you have low levels of oxygen. And the chilled is because if you don't have enough oxygen, your metabolism also going to go down. And metabolism provides what? Your body heat. So basically, if you have low metabolism because you don't have enough blood, your body cannot generate enough heat, and therefore you feel chilled. Now, typically, you can have significant blood loss that causes anemia, and you can fix that with a simple blood transfusion, like somebody that's gotten into a car accident. As I mentioned, you have a sort of anemia called iron deficiency anemia, which basically means your body does not have access to iron, and as a result, it cannot produce new red blood cells. Typically, you can resolve that by either taking iron supplements or increasing it inside your dietary intake. And spinach is a really good source for it. Another reason for anemia could be high levels of red blood cell destruction, which basically known as hemolytic. Heme as in red blood cells, lytic means destruction, or lysis means destruction. So hemolytic anemia simply means that you have either some sort of abnormality in the hemoglobin, or you have some sort of infection that causes an increase in destruction of red blood cells. Another common type of anemia is known as lack of vitamin B12, which is called pernicious anemia. So vitamin B12 is necessary for the division of red blood cells in the early stages of development. So if that doesn't happen, cell remains immature. But it's very easy to basically recover from it, because what you do need is a vitamin B12 injection, and basically you're set to go. That allows the RBCs to mature, and your blood cell production should go back to normal. If you are a vegetarian, you're more susceptible to this type of deficiency because there is no meat in diet, which will basically bring in vitamin B12. So basically, you can consume food that are rich in vitamin B12, take supplements of vitamin B12 to help with pernicious anemia. Last one, which is very interesting, is associated with your kidney, hence the name renal anemia. So in your kidney, let me just bring a point to you guys before we explain this. If I want to produce, so RBC production actually relies on a hormone called erythropoietin, which we shorthand to EPO, that is produced by your kidney. So kidney produces EPO, which goes to red bone marrow, and that basically causes RBC production. Now, you always would have EPO in your bloodstream, doesn't matter. But if you have some sort of kidney disease, what happens is that the levels of EPO drops, okay? That means there is a decrease in RBC, which translates to anemia. So what is your solution? Get injections of EPO, which basically they give you the hormone to replace the hormone that's normally produced by your kidney. If you do talk about leukocytes as far as the blood disorders, most common one is known as leukemia, which is a form of cancer, and there is abnormal growth in the form of your white blood cells. And if we're talking about platelets, we have thrombocytopenia, which is abnormally low concentration of platelets. In such cases, people, if they have any sort of cut, it takes a long time for them to heal, or sorry, not to heal, to stop bleeding. So they basically have excessive amount of bleeding. Let me just go back to one quick slide. Red bone marrow and yellow bone marrow, I mentioned it earlier, but make sure that you know red bone marrow is basically when you have blood cell production. Yellow bone marrow is typically fat cells, so it's just the storage of energy. And this is a really good picture that represents what your red bone marrow actually looks like under the microscope. And I think it's kind of cool for you guys to actually see it. Okay, that is it for our blood lecture. If you do have any questions, please let me know.